Hey YouTube, it's me, Nurse Leslie, the Beauty on Duty. Today I'm coming to you to share with you my first clinical of the second semester, and let me tell you, it was awesome. I thought last semester's last day was really great. This semester's first day beat it hands down. Okay, we got to do so much hands-on. It's really exciting, really fast-paced, like going from one room to the next, doing treatments, passing meds, wound care. Oh my gosh, wait until you hear about my day at clinical. But first, let me share with you my nursing uniform. This is what I wear to clinical. Let me start from the top. So we have to wear our hair up. I have it in a bun, a high bun. Everything has to be off the collar. I wear one pair of post earrings, modest makeup, definitely need your stethoscope. Here's my name tag, my hospital ID, and the scrub top has to have our school's nursing insignia. So red scrub top, white scrub bottoms, as well as all white nursing shoes. These are actually Dansko, and they have a rubber tip around the toe, which is really great in case you kick something. It's not going to scratch the leather. They have really awesome arch support. In comparison to my nursemaid's shoes, which I also love, these have better arch support, but the nursemaids have more cushion. I like them both, but I'm going to wear these this semester just because they're a little bit more comfortable for the shape of my foot. But yeah, this is my nursing uniform. And we were required just to have these colors. The school has, uniforms available in the bookstore, but they're unisex, so they're very boxy, big. They don't really fit well, so I went out and got, cuter shaped clothes. But let's get to the good part. So, okay, we're in the hospital, medical surgical. The first cool thing that I saw was a very, very sweet woman who had diabetes, and her diabetes was definitely uncontrolled, so we had to give her insulin. And when I saw the wound nurse unwrap her foot, oh my God, I have never, ever seen anything so bad. I'm telling you, I felt like I was going to pass out. Thank God I didn't pass out, but oh my goodness. Her foot had to have been this big, swollen, with about 3/4 of the way down, a huge just ulcer with the tissue gone. I'd seen pictures, I'd seen videos, I've seen it in the books, but seeing it right there, oh my goodness. It was amazing. So, they packed the wound, they did a wet to dry dressing. They packed the wound with gauze, well, not really gauze, but like some type of gauze material. And they did give her morphine before her wound change, or her dressing change, but she still screamed. I held her hand while the nurse took care of her dressing change, and she was just in so much pain. I felt so bad for her, but it was really cool to see that. Really, really cool. She was actually in contact isolation because she had a history of MRSA. The MRSA infection wasn't active, but she has had MRSA in the past. So, yeah, she was in contact isolation. They actually had a few people in contact isolation that this nurse was taking care of. So the next thing that I saw was a plasma change. I didn't even know people did this, but the guy was hooked up to a machine that looked like a dialysis machine, except for it was pulling his plasma out and putting new plasma in. So that was really cool. The next cool thing I saw, oh my gosh, very attractive young guy, came in because he says he was intimate with someone, and that person said that they had an STD, so he came in to get checked out. So that was interesting. The next thing, I got to do my first Foley catheter insertion. It was so awesome. So this woman, she had to have been almost 100 years old. God bless her. let me just say, you know, everybody's anatomy is a little bit different, but I have never in my life seen a vagina look like this, okay? And I'm an esthetician. I do Brazilian waxes all the time, so I've seen quite a few vaginas, okay? Not a huge deal. But, I mean, man, it was like just skin balled up and hanging in every which way. So doing the Foley catheter was not very easy. First try, I got it in the wrong hole. Okay, so now you know where not to go. No big deal. We get a new kit, we start the whole sterile procedure again, and the nurse is like, okay, you see it? It's right there. And I push it where she tells me to push it. Still wasn't it. So she's like, okay, let me try it. But first I'm going to get a lady from labor and delivery, because on labor and delivery, they do Foley catheters all the time. So she calls the lady down from labor and delivery. She comes and she observes. She's like, okay, do you see it? You got it? So the nurse that I was shadowing, she got it in the wrong hole. So that's the third Foley catheter kit. So the lady from labor and delivery, she's like, okay, well, I'll just do it. So what she did is, and this I think we should have done at first, but we didn't, get some dry gauze so you can literally pull the skin back, you know, instead of holding it with one hand. And it helps if you have help, you know, have somebody to hold it back for you. So I held the skin back for her, and she inserted it into the urethra, and the way that I pulled it back, it was very, very visible where the urethra was, so there was no problem. So on the fourth try, we finally got it, and you know, she wasn't very uncomfortable until we actually got it through the urethra, and then it was over. So, and she actually had her daughter there, she had her son there. The son stepped out, of course, but yeah, it was a really, really cool experience. Not all of my classmates got to do that, so, you know, but, you know, I did, and I shared with them. So next time when they do a Foley catheter insertion, hopefully they won't have the troubles that I did. Hopefully you won't have the troubles that I did. But it was nevertheless a really awesome experience. I wouldn't trade it for the world, because I don't think I'm ever going to have to use 4 Foley catheter kits on a patient ever again. But it was just really, really fun, really high paced. Got to do apply cardiac monitors to a couple of people. One guy, he had a cardiac monitor attached to him, but somehow he took it out, put it down his adult diaper, between his butt cheeks, up through the middle, and put it back on his chest. So we're like, how did you do that? And he actually had feces in his adult diaper. So we had to wipe the cords down with, you know, disinfectant wipes. And we're just like, okay, sir, don't know what you were doing in here while we were gone, but let's get you fixed up. So that was really interesting, but we had such an awesome time. I love the residents at the long-term care facility, but like I told you in another video, they just were not sick. You know, I miss them dearly. They were very sweet, elderly people, but I'll take the action at the hospital. You know, that's just my preference. So I hope you guys are having a great first semester. Everything's going really fast-paced right now. We're learning a whole lot. So, you know, wish me luck in my studies. We've got exams coming this Friday. So let me get up off this video and go study. But it was great talking to you guys, and I'll see you on the next video. Oh, and don't forget to subscribe and rate and leave comments. I'll see you on the next video, guys. Bye-bye.